Discovery and innovation in medicine. You might be very surprised how it comes about. So let's have a look at it. Discovery. Well, try to look at it better understanding of the body structure, such as description of DNA in 1953. There's a major conceptual breakthrough. A work of 3 scientists, but they actually drew on the work of a lady science next door and used all her ideas. Their model their model for the DNA was actually a brain model. Just put it together. There's little research behind it. New chemicals in the body, looking for hormones and neurotransmitters. This does require the work of scientists, e.g. description of insulin over many years. The cause of a disease, that actually is often serendipitous. One is AIDS, TB over 100 years ago. It took a long scientific work for Koch, K-O-C-H, and then HIV. Took a while. New drug treatment. That can be serendipitous. It just notice the effect of one particular drug and see it may work for something else. And of course, we're all drawn now into the new vaccine. That does require a lot of scientific work. An example is Jonas Salk looking for TB took many years, but COVID has been done really rapidly. So it does show progress in that area. So that's discovery, new drugs. Then we look at new operations. That's usually the preserve of surgeons. Scientists can't really design new operations. Surgeons may do some research on brain model animals usually, and then start working on how to do it. And patients in dire straits. Kidney transplant failure, patients dying. Joe Murray did the first one in 1953. Heart transplants were done on patients could only live for another few days or few weeks at the most. So they tried that. These are technical procedures. The surgeon has to show how technically it can be done. They always get a lot of media attention. The surgeon is hailed as a genius or a great pioneer, but it's technical, showing the surgery, the operation can technically be done. A new way to do operations. So another example there is a better way to do an established operation, like a hip replacement done through a long cut, working out how it can be done through small cuts. And of course, these other areas, better imaging, of course, the X-ray over 100 years ago, and MRI the last 40 years or so. So a lot of the things in medicine just happen chance. People work out how to do it. Often it doesn't take years to develop. Some areas like new chemicals do take years of scientists, but doctors work in the area. Often it's just a chance observation, especially in surgery, where surgeons have to technically work out how to do it. In other words, like a cookbook for doing an operation or a set of instructions.